Welcome again, my champions, mental health champions. This is your girl J. Kelly, and we've been talking about postpartum depression, PPD, as we commonly call it. If you're new to my channel, I am J. Kelly, a psychiatric mental health nurse practitioner, and on this channel, we talk about everything mental health. We talk about mental health awareness. We sensitize people about mental health, and we discuss some topics that affect our everyday mental health. Disclaimer: this is no way a diagnostic tool for you, so don't use my video like trying to diagnose yourself or diagnose your kid or your family member. Leave that to the professionals. If you're suffering from from any kind of mental health symptoms, please, I'll encourage you to seek help, and we'll be more than happy to assist you with that. So we will continue today with our video on postpartum depression, and today we're going to be talking about the types of postpartum depression. Postpartum depression is a very broad term that encompasses different types of mood disorders that can occur after childbirth. And some of the types of postpartum depression can include postpartum major depression, PMD. This is the most common type of PPD. Women experiencing postpartum major depression may have intense feelings of sadness, hopelessness, loss of interest in pleasurable activities. Maybe you used to be a good cook or somebody that likes to garden like me, somebody likes to clean. You suddenly realize that you lost interest in those things. You lost your appetite, you lose sleep, you're tired, and you have difficulty concentrating. And the second type of postpartum depression, we have postpartum anxiety. Postpartum anxiety involves excessive worry or fear about the health or the well-being of the baby, yourself, or both. Women with postpartum anxiety may experience racing thoughts, restlessness, and physical symptoms such as heart palpitation and dizziness. And number three, the third type of postpartum depression, we have postpartum panic disorder. So you realize that anxiety, panic disorder, they all go hand in hand, even when you're suffering from PPD. Postpartum panic disorder is characterized by a sudden and intense episode of fear or panic. This panic attack can be accompanied by symptoms such as racing heart rate, shortness of breath, trembling, you have some nausea, you feel like you're losing control, you feel like you're going crazy, you have that sense of impending doom, like something, you're about to die. That's what panic attack, even in postpartum, it can manifest itself in that way. And our fourth postpartum type will be OCD, postpartum OCD. You'll be like, what is OCD coming to do in postpartum years? One of the types of postpartum will be OCD, and this include like intrusive or distressing thoughts or images of obsession that can relate to harm coming to the baby or oneself. To alleviate the anxiety caused by this thought, women may engage in repetitive behaviors. You tend to wash and wash, checking on stuff, counting and cleaning and cleaning and cleaning. So this is how OCD can also manifest with postpartum depression. Number 5, we have postpartum PTSD. I'll tell you, postpartum PTSD is so real. Some women may develop PTSD, postpartum PTSD, after experiencing a traumatic childbirth or a perceived threat to the life or the life of their baby during labor or delivery. And some of the symptoms can include flashbacks, nightmares, and avoidance of reminders of the trauma. And I would like to tell you my story on postpartum PTSD. During my third delivery or my third pregnancy, it was a very traumatic one. Throughout the pregnancy, we didn't know if that baby was going to live or not. And after that, I had an emergency C-section because they were like, hey, he's not going to live. So it was a 50-50 chance for the baby and 50-50 chance for me, even post-op. So after that time and up till now, I still think of that moment. I still think of that pregnancy. I still think of that intense feeling that I had before delivery or after surgery. And most of the time, I go ahead telling my husband, I say, if this was our first child, it was going to be the last because of the trauma that followed that pregnancy, or because of the trauma that followed that delivery. I still suffer from that PTSD moment. So I think about it now and then, and it kind of bring me some kind of nightmare. The last type of PPD that we're going to talk about is postpartum psychosis. Remember, if you've not yet watched the first or second part, this is the third part of PPD video. You can go back and watch those two parts. We talk about that psychosis. We did not go intense, but postpartum psychosis is the most severe. It's rare, but it's the most severe form of postpartum mood disorder. Postpartum psychosis involves experiencing hallucination. Yeah, you can have visual or auditory hallucination. You see things that are not there. You hear voices. You hear things that are not real. You have delusions. You have disorganized thinking. And women with postpartum psychosis may be at risk of harming themselves or their baby, and they require immediate attention. So it is important to know that these types of postpartum depression can overlap, and because you're unique, symptoms can vary widely from one individual to the other. That is why we encourage you that if you or somebody that is going through these symptoms, it will be crucial for you to seek help, so that professional help, so that we can appropriately evaluate and treat what you're going through. So early detection and intervention is key that can lead to effective management of PPD during those challenging times. We are going to move forward. We're going to talk about treatment and prevention. I know you've been waiting for this particular time to be like, hey, so how can we manage this whole thing? So postpartum depression, just like any other ailment or just like any other symptoms that you might have, or mental health or even physical ailment, can involve, the prevention can involve a professional support, self-care, and awareness. So you have to first of all understand, educate yourself. Even during pregnancy, read books about postpartum. Talk to your gynec about these things that you can have, not just the baby blues. Baby blues last just for for a little period of time, while any severity of symptoms that last for more than 2 weeks, you might already be suffering from PPD. So we will recommend to seek help. So here are some strategies for both. So the first treatment of choice that I commonly recommend is psychotherapy, and especially cognitive behavioral therapy. It is often the first line treatment of postpartum depression. These therapies can help individuals identify and challenge negative thoughts, especially when you're dealing with PTSD, OCD, or even psychosis. This can help you challenge those negative thoughts, or challenge those, that feeling that you're having. They can help you develop coping mechanisms, coping skills, and improve communication relationship, not only between you, but between you and your spouse, between you and other children at home, between you and family members, and also develop a bond between you and that baby, because postpartum is something that can cause, that can sever a bond, the bond that you have between you and that baby. So it is very important to talk about it. It is very important to seek help. We also do medication. That is why it is always important that even during pregnancy, we talk about all these things. When you go to prenatal care, it is important to talk to your doctor about all these things. Maybe you have experienced some symptoms of depression before, which puts you at a higher risk of developing PPD. That's the moment when you have to talk to your doctor about this. They can go ahead and anticipate medication before that will help you, manage these symptoms better. Remember, we talk about antidepressants like SSRI. This SSRI, one of the go-to one will be Zoloft or sertraline. We call it squalane because you can breastfeed with that. You can squeeze through the breast milk and it will not be any problem with the baby. So that is my number one medication. Please don't try to just come in and be like, hey, I need sertraline or I need this medication. Let the professional evaluate your symptoms and know what you can have for that. It is also very essential to consult with your healthcare provider to discuss the benefit and the potential risk of medication during pregnancy and breastfeeding. That's why we collaborate hand in hand. If we are having a nursing mother or a woman that is planning of getting pregnant, we would love to collaborate with your other physicians to see how we can better manage your health. We also have support groups, meeting people that have gone through it or that are going through the same thing that you are going through is very important. You will realize that you are not alone on the fight. There are people that have walked your walk and walk in your shoes. So it is very important to get into support groups that will help, connect with others that have similar experiences, sharing stories, providing validation, and receiving support from others. So self-care, we hear again about self-care. Prioritizing care is vital for recovery. Remember on our previous video, we talked about sleep. When the baby sleeps, we encourage you to go ahead and take a nap too. It's not the time for you to make all those phone calls. It's not the time for you to welcome visitors. You can let people know that, hey, maybe as soon as you get back home from the hospital, you can let people know, hey, we are very sorry, this time we want to use this time to heal a little bit. Yeah, because delivery, you will need to heal. Even if you didn't have surgery, you will need to heal. That will be a time for you to to get some good sleep, get some, good family bonding time with the baby. Practice mindfulness, practice meditation, practice any kind of thing like yoga or something that will help you relax. Practice some relaxation, practice some deep breathing. Yes, get enough rest and maintain a healthy diet. You can do some light exercises, that will keep your physical and emotional health together and help your mental health well-being. We also recommend that you take a little walk. Maybe you can take a little walk around the block in your neighborhood. Just get out of the house, take a little short breaks and walk around. Be realistic about your expectation of yourself and the baby. Expect that there will be some good and some bad days. Yeah, when you have a newborn baby, expect that there will be some good and some bad days. So every day is not just going to be like, hey, joyful. There's going to be some ups and downs, just like any other day in your life. But now you have this little bundle of joy you're taking care of. So there will be some good and some bad days where baby will foresee and things will not just go right and you feel overwhelmed. That's why we encourage naps and everything else. Foster a relationship between you and your partner. Make time for each other. Yeah, when that baby is sleeping, try to bond with your partner, because what you're feeling, we say the fathers in the first year of them having that new baby, they also go through some kind of depression, because not only their wives is trying to bond with the baby, take care of the baby, they feel somehow left out of the whole process. Some of them feel abandoned and they also feel lonely. And the same way you'll be feeling lonely when you're dealing with PPD, your husband might be feeling that as well, your partner might be feeling that as well. So it would be realistic to go ahead and foster a relationship, make time for one another, talk things out, and both together you can come out of postpartum depression. Limit visitation. Limit visitors when you first get home. We talk about that. Limit visitors. Screen your phone calls. Sleep or rest. Yes, screen your phone calls. It is not a big deal. Screen your phone calls. Be like, hey, I don't want to talk on the phone for 30 minutes. I don't want to talk on the phone for 1 hour. Text your friends like, hey, I will appreciate if you text, and I will respond whenever I am available. Everybody will understand that. Now, social support. We can on family members, we can on friends. You build building and maintaining a strong social support is very crucial. Seek help from family, seek help from friends. If you feel like you want to have that friend over to come and help with the baby for an hour while you take a nap, is very important. If you feel like you want to have your mother-in-law, somebody, a colleague come around and help a little bit. Communicate openly about your feelings, about your needs, and having the emotional support can help alleviate the symptoms, the feelings of isolation, loneliness, or any symptoms of PPD that you might be feeling. Now let's go and talk about prevention. Screening. Routine screening for PPD, postpartum depression during prenatal and postnatal checkups can help identify, if you're at risk and provide timely intervention. Educational programs. I've talked about reading books about postpartum. You've heard that all your life as a young girl. Now you are in your own home and you're having your own child. You've heard people talk about baby blues. You've heard people talk about postpartum depression. Yeah, go ahead and educate yourself about it. Ask for help. Ask your mental health. Ask your counselors. Ask your gynecologist. Ask your primary care provider. What is postpartum depression? What are the symptoms? How can I work around that? Yeah, ask questions and have resources. You can find some resources online, and raising awareness can promote early detection and timely intervention, which is what we are doing in our videos. We are raising awareness that postpartum depression is real, it is preventable, and it is treatable. So please don't feel left out. You are not alone in the fight. Planning and preparation. Plan for the postpartum period by identifying potential stressors. Yeah, if you're planning, just like you're anticipating for the coming of that baby, go ahead and anticipate planning for PPD. Identify those things that can become a stressor and learn how to manage them. And having the support system in place is very beneficial to help you plan ahead of time. Postpartum wellness plan. Yeah, wellness plan that include self-care activities, support networks, and potential resources for professional, resources for professional help if needed. Get those numbers, get those go-to resources. Yeah, get that counselor, get that mental health expert already with a number, or somebody refer to you that you can go to if at all you're experiencing this whole thing. We also have communication and openness. It is very important. We encourage communication about your emotions and mental health concerns during and after pregnancies. This will help to reduce the stigma and foster understanding that can make easier for individuals seeking help. Mindful scheduling. Yeah, mindful scheduling. Be mindful of scheduling and avoid taking too many responsibilities immediately after childbirth. Please take time to rest and avoid, piling all that work. Be like, hey, I can work from home. Yeah, I can do this. I can multitask. I can do that. No, those little things just creeping, the symptoms creeping on you, and you might not be able to catch it on time, and you have to allow time for recovery after childbirth. So remember, it is very important. We can use medication, we can use support groups, we can use self-care, we can use therapy. It is very important. So if you know someone who's experiencing postpartum depression, don't hesitate to reach out or to a healthcare provider or mental health professional for guidance and treatment. So you that are watching me, sharing is free, subscribing to the channel is free. Go ahead and share, love, comment, and let us know what you think about postpartum depression. And don't forget to smash that subscribe button. Yes, smash it in so that you will not miss any other video that we will be posting. I love you, and take care of your mental health. Bye-bye.